to this seminar, which is co-hosted by IGC International Growth Center and Asia Development Research Institute, which is based out of Patna, Bihar. And it is also the International Day for Elimination of Violence Against Women. So it's a very appropriate day. I thank the organizers to choose this day to have an discussion or a conversation on a very important issue with esteemed panelists. We have had attrition in our panel, unfortunately, due to unavoidable circumstances for two of our panelists, just coincidentally. So let me first introduce the panelists. We have Dr. Anamika Priyadarshini. She's currently a lead researcher at the Center for Catalyzing Change. She has a master's in international development from Cornell and a PhD in global gender studies from the SUNY State University of New York in Buffalo. And she has worked with various development organizations on a range of issues that pertain to gender and development, and has obviously written a fair amount on some of these issues, especially around women's home based work. Followed by that, we have Dr. Girija Borkar. She's an economist in the Impact Evaluation Unit of the Development Research Group at the World Bank. She's a development economist and primarily working on gender, violence, education, and transport in the urban areas. So her ongoing work, is in looking at the economic consequences of sexual harassment in public spaces, and looking at the effectiveness of public policies that are designed to address women's mobility in public spaces or women's safety in public spaces. Lastly, we have Dr. Padma Deosthali, who is a senior advisor with CEHAT, and she is well known for doing very seminal work actually in India on trying to set up public health response to violence against women. So she has about 20 years experience working on gender based violence and public health. She's set up health systems models for responding to violence against women and has worked on WHO clinical guidelines for the same, and is being part of the international steering group of the WHO also on the similar issues, and so has worked actively also with the government of India, government of Bihar, and she holds a PhD from TIS, Tata Institute of Social Sciences, and has also worked closely with several multilateral organizations. The only thing that I really want to emphasize on the significance of this issue is even pre-COVID, we know that violence against women is a significant human rights issue and has, in the last decade and a half, been also appropriately been positioned as a public health issue because the prevalence of intimate partner violence worldwide is 1 in 3 women who have ever experienced either physical or sexual violence in their lifetime. You find that across the board in developed and low to middle income countries. So this isn't a problem of the poor, of poverty, but this really persists at all socioeconomic classes. We also find that this has a huge cost to the economy because it affects women's participation, women and girls' participation in the economy, plus obviously has many other implications on household economies, growth, care for children, as well as public health issues that women themselves experience, which have been adequately researched and documented that include low birth weight, stunting, as well as women's sexual reproductive health problems, mental health, and lack of ability to persistently work and retain their work jobs in the economy. And many other issues that we'll also discuss in the panel today. Post COVID, of course, I think what has really become important is that this has become a part of a larger public discourse. That we know that it has disadvantaged everybody, but posed unique and disproportionate challenges for women. The mandatory lockdown in India showed early data that violence against women was exponentially rising throughout the country. And we have data from the National Commission of Women that shows that in India, women filed more domestic violence complaints during the lockdown than recorded in a similar period in the last 10 years. So we have statistics that between March and May, 1,477 complaints of domestic violence have been registered in this 68-day lockdown period, that first big lockdown. And also, there's early evidence that suggests that domestic violence complaints have increased 131% in May 2020. This has all been discussed. Early in the pandemic, we did not know whether there was enough documented evidence, although there was a lot of suspicion that we would see a lot of violence emerging. But as the time has gone by, we are seeing emerging evidence. And most of these statistics are, in any case, not complete. So we know whatever is reported is only a subset of probably what is being experienced. For us, this is a very important issue because. Because we've always positioned violence against women as a global pandemic, and now we are actually facing a global pandemic. So I think the combination of the two are actually lethal for women and girls, and that's a issue that we want to discuss with the gravity that it really poses. Girija, maybe you'd start with what are your views on this data that we have, that India's female labor force participation was 18.6% in 2019, with a significant proportion currently engaged in the unorganized sector. So we know that this is really low compared to other similar countries. And then in Bihar, it's as low as 9%. So, what are some of the underlying factors that affect women's reluctance or inability to enter workforce, and that should be addressed as an economic priority? If you can speak to that, and also whether your perspective can be both what are some of these issues and what has happened post COVID.
Thank you so much, Priya, and thanks to IGC for organizing this panel and also inviting me. I really appreciate it. This is such an important issue. So Priya has already laid out that India has very low female labor force participation rates relative to the rest of the world. But just to give you a sense, globally, 1 out of every 2 adult women participates in the labor force compared to about 3 out of 4 men. And India is pretty much, the same as per the global average for men, where 3 out of 4 men are working in India. But for women, it's actually 1 out of 5 women. So India is behind in female labor force participation rates, not just relative to the rest of the world, but also actually within South Asia, it has one of the lowest rates of female labor force participation. And also, I think, we can all agree that women's participation in the labor force is an outcome that we should be, we are all interested in itself. It's an end in itself because it leads to greater autonomy for women and, sort of letting them achieve their potential in the labor force because of this participation. But also, it is a means to an end, in that we see that, women who have greater autonomy and greater decision-making power and sort of the concomitant bargaining power in the household can affect equality in many other domains, such as access to healthcare, better child outcomes. So we do know from the existing research that there are many potential reasons for why we see low labor force participation by women, and so there's a whole plethora of reasons. So these range from expectations for women and also the requirement for them to do bulk of the housework and childcare. And this is a norm that is prevalent in both developed and developing countries. So this is sort of affecting women globally. And because of this, women have fewer working hours, they have greater cognitive load, they require greater flexibility in the workforce, and all of these limit the opportunities that women can potentially access, and also their ability to search for work. Then there's other reasons like which is relevant for Bihar, for example, the sectoral structure of employment. It's possible that there is just a mismatch in the sectors in which women want to work, and the sectors that are actually looking for women. So even if women want to work, there's just not opportunities in the economy for them to find such jobs, which then leads to lower female labor force participation. My work, and this is what I want to focus on today, is one major possible barrier for women, which is street harassment, or the harassment that women face in public spaces, which can hold back women at many stages of their life, and sort of has the potential to wipe out a lot of the investments that are made in women at early stages, from childhood to adulthood. So India is ranked as one of the most dangerous countries for women to be in, by a recent study by Thomson Reuters Foundation. And women have been reported to actively take precautions to avoid feeling unsafe. So there's approximately 84% of women in cities in India that are aged 40 years or younger that say that they actively avoid certain parts of the city to feel safer, to avoid harassment or the fear of it. So it doesn't necessarily need to be incidents, but just the perceived safety. So if they perceive areas as being unsafe, then they choose not to go there. So in my research, I find that women in Delhi, college-going women in Delhi, are willing to choose, are willing to go from a top 20% college to a bottom 50% college, just to sort of feel safer while traveling. And they're also willing to pay almost 18,000 rupees per annum, which is 2 times the annual tuition in Delhi University, which is where the study is based. So these are huge sort of costs that women are willing to incur to feel safe, just to travel to college. And this is the top university. I mean, Delhi University is one of the most prestigious universities in India. So these are, high achieving women in a top university that are willing to make these trade-offs. So one can only imagine that, what are women who have not even, entered college education are willing to do to feel safer, and change their choices because of the fear of harassment. There's also other pieces of work from India, which by Chakrabarti and Siddiqui, that show strong negative correlation between perceived violence or crime and female employment in India. Then we know college education is affected by the fear of harassment. Women's entry into the labor force is affected by the fear of harassment or other safety concerns. But there's also evidence from the US, which looks at, but I think is highly relevant for India as well, which looks at the intensive margin, or the intensity with which women participate, or the hours that they're working and where they're working. So there's this recent work in the US with Uber drivers. So Uber is very special in that they offer the same wage rates to both men and women. And then, based on this, we can rule out discrimination over wage rates. But if we look at the earnings, we still see that women Uber drivers are earning lesser than male Uber drivers. And one of the reasons one of the driving forces for this is women choosing to drive in more safe areas or less dangerous areas, which in turn have where areas where there's greater danger are also areas where you earn more when you drive, and they're actively avoiding that. So we can see that safety is affecting how women study, where they work, how much they work, based on existing evidence. And as I said earlier, this is a serious barrier, and very disturbing, because it has the potential to literally wipe out the investments that are made in childhood and adulthood, where we see that women in Delhi, for example, are not only competing with men, but actually beating men in class 12th exams. But then they're choosing to attend colleges that are lower quality, and sort of wiping out all these gains that they've made. In terms of the second part of the question of, how has COVID affected these issues that women are facing, sort of sticking to the mobility challenge for women, the restrictions that have been placed as part of COVID in public spaces, especially public transport, have affected women particularly badly. So, despite women making up a smaller share of travelers by public transport, so there's fewer women who you see. For example, on average in Delhi, we see about 1/3 of the travelers by bus are women. But when women travel, they are more dependent on public transport than men. So this is because of limited access to first private transport, also access to lower financial resources on average compared to men. And this combined with the fact that women are usually only travel during off peak hours and trip chain or combine multiple tasks and destinations, we see that this reduced access to public transport has hit them very hard. Even if they want to travel, they do not have the opportunity to travel. And then these limitations have just amplified the negative effects of the pandemic that they face at home. I can maybe stop here.
So, Girija, before you kind of completely stop on this round, I just wanted you to, like, there is a question as to something very basic, like, what are the reasons women face sexual harassment in India? So, could you break it down? I mean, I think it's easy to say patriarchy, right? But could you help us understand why does this happen? Is this, it's quite a deep and pervasive phenomenon which is very high in South Asia, right? Like, can you talk a little bit about that?
Yes, absolutely. So even though it's easy to say patriarchy, I think this does start at a very early stage, and everything. You mentioned that we are going to be focusing on the interventions, and everything that we can do in the short term is sort of reactive and not truly hitting where we need to. But yes, so there are many reasons why sexual harassment exists, and yes, it is a problem in South Asia, which is sort of the proportion is much higher. But if we look at a lot of rapidly urbanizing countries and cities, we see that this is a problem sort of across the globe. We know from Latin America that this is a problem in almost all major cities in Latin America as well, and we see similar sort of negative consequences on economic choices there. In terms of what I think is the main reason, I think it is deep rooted patriarchal norms, where there is this sort of expectation that women have delineated roles and they should stick to them. And that is why we see that there is, we know from the domestic violence literature as well that there's this strong backlash effect from women's greater economic autonomy. We see that women entering in public spaces to study, to work, they face similar backlash. So for me, that is definitely the top reason. And also in terms of what we see has worked in changing in reducing violence or attitudes towards it, we see that starting early has the maximum effect.
Okay. And Girija, what are the sources where we collect data on sexual harassment that women face? And is that data available disaggregated by age and caste and some other categories, social vulnerability?
This is such a great point, Priya. I was recently reading this book called Invisible Women and the Data Bias. And this is one place where I think that is the first step: measurement, proper measurement of this problem. There is not much data. I mean, the biggest data source that we rely on is the NCRB, National Crime Records Bureau data, which only records, first of all, actual reported incidents. And if you look at those categories, they're very, very broad. We already know reporting is a problem. So when we go looking for data on harassment, we are dependent on these broad categories, which are made available to researchers like us or, people, almost everyone in this space at the district level, which doesn't tells us very little. And that is actual reported incidents. There is a lot. I mean, now that I'm working in other countries on this as well. India is sort of advanced in terms of recording perceived safety. So there's the amazing data by Safety Pin, which started very early in response to the Nirbhaya rape case, recording audits on factors that we know feed into women's perceptions of safety. So that is amazing data that we at least have and does not even exist in other spaces. Those similar apps do exist, but yeah.
Yeah, no, I think that safety pin was a huge contribution to be able to
Yes.
get women's perceived data, perceived lack of safety. Just wanted to kind of emphasize something that Girija said, which was that women are willing to sacrifice like their wages, pay more, and earn less to basically feel safer. And I think that's really important as we get deeper into the conversation around this. Let's move to Padma then, and then I'll come back to Girija. And there are lots of questions from the audience, which are lovely. So I hope we'll have time now. So, Padma, I actually want you to talk about the fact that often the health systems ends up seeing women in crisis as victims of or survivors of extreme forms of violence, and often the health system is not able to respond to violence in a preemptive, preventive way. Often even not able to deal with it in terms of what we would consider as a proper treatment. Could you discuss how does the health systems in reality deal with it, and how should it optimally address violence against women, and also if there have been any recent successful interventions in India on this? So over to you.
Thank you, ISC, and thanks, Priya. It's a pleasure to be on this panel, and I hope we can have a good discussion. As you said, the health systems have a clinical, legal, as well as a policy mandate now, because in India, it's only in 2017 that we have the health policy, the national health policy, actually recognizing gender-based violence as a public health issue. So till then, although there is the clinical and legal mandate always existed, as you said, women survivors are reaching hospitals, and they are being, taken care of. May not be as per the standards we expect, but yes, they already reaching out. So if you look at gender-based violence, we have the Ministry of Health having issued national guidelines for medical legal care for sexual violence survivors only in 2014. And till date, we have no national guidelines or protocols for responding to domestic violence, including intimate partner violence. So I'm going to use domestic violence as the overarching term. And there are no such guidelines. And, in terms of the attitudes and the misconceptions, biases of providers themselves, to top it all, the other concern with the current response is also the fact that they have absolutely no training on how they should be responding. So the response is limited often to symptomatic treatment. So if she has, whatever is her treatment regime, so if she's presenting with an injury, she's provided injury treatment, that's the end of it. So the fact that there's more to it, there's a more responsible role that they need to play, both in terms of reaching out to her psychologically, is not something that is taken care of. Coming to what has been the experience and the whole way in which the policy has today come to recognize it as a public health issue, there have been efforts made by a lot of civil society organizations, and they start from 2000. And I'll just kind of quickly look at, point out what have been those interventions. So one of the kind of, or a type of intervention with health system has been crisis intervention departments. And even there you have two different kinds of crisis intervention departments. One are those that have been now integrated under the National Health Mission. So these have been set up in district hospitals. So you have examples of Dilasas in Mumbai, Bhumikas in Kerala, Sukuns in Haryana, the Goa district hospitals, Meghalaya district hospital, and all of them have staff who's running these departments. So in a sense, the hospital or the health system takes on the responsibility of responding to violence against women. It has institutionalized the response. They have designated nodal officers, and there's ongoing staff training of the hospital staff, as well as all the staff attached to the other facilities to the district hospital, like the sub-district hospital, the PHCs and others. So that's one kind that one can see, and these have emerged from 2014 to now. So in the last 7-8 years, you see this entire, range of institutionalized response to violence against women at state level. The other, of course, have been, they pan from 2000, are those that are being run by, through joint, partnership between governments and the NGOs. So you have them in Mumbai with Sneha, Swati in Gujarat, Bangalore, with Sunita Krishnan, I think she's here, and many such services that were led by either, health researchers or civil society, women's groups that have been running these services. An edited volume of all these interventions has just been published by Routledge in May 2020. And some of you may be interested in that. It's an edited volume where all these practices and different types of, responses have been documented. So that's one. The volume actually traces the whole evolution of violence against women as a public health concern in India. And these are some of the experiences of the last 20 years. And some recent examples, maybe we can talk about it later, but I'll just flag them, is the whole rolling out of the clinical guidelines of WHO that were issued in 2013. These are being done through some collaborative work with WHO Geneva in 2 medical colleges in Maharashtra, as well as in Bihar. In the Vaishali district, Care India and the government of Bihar have been working towards setting up an entire health systems response in the district hospital and sub-district hospital and 3 PHCs. So there are 5 health facilities.
Padma, very quickly before I move on, one of the arguments, and I mean, I think people who work with very fragmented public health systems and weak public health systems, especially in some of our EAG states, would argue that we need to kind of fortify the health system, which can't even deliver some of the basic essential. Well, not that I don't think this is either basic or essential, but what is considered essential healthcare services for women. What would your response be to that?
So my response, yes, it's a very common concern, Priya, and it's also used as a way to resist any work on violence against women and relegate it to the WCD and say that we have no capacity, our health system is already weak. And I think my response is that women are anyways going to the public health system, and we all know that all of us working on health know that those who are reaching public hospitals are largely women from the lower socioeconomic class, and they need these services the most, and therefore they are already going there. The hospital is, or the health providers are already dealing with it. And I think by expecting them to provide a standard of care, we are only ensuring better quality of service. So it's not an addition. I really would say that. And all these examples, in the last 20 years have taught us that providers who get trained, they understand that they can actually really integrate it into their existing time. It's not spending more time, really.
So yeah, I think the magic word is integration, right? That it should be integrated into the ongoing standard of care. And I think the other thing from what I've learned on this issue is that the public health effects, the health effects of violence, are inseparable for women.
Absolutely.
So, in fact, it's also integrated in her physiology and how the symptoms, as you said, the symptoms get treated, but the underlying causes don't.
Absolutely.
So, but the underlying causes are part of the manifest symptoms as well, right?
Yeah.
So we'll come back to you because I know we'll go a little bit deeper into Bihar and some of the examples. Can you talk a little bit? I think we'll make it simple for you because you're having problems. To you, we were going to really talk about the role electoral representatives can play on issues of violence against women. So whether you can just reflect and even maybe take a second question now, what might be like, if you look at it from an ecosystem perspective, what is the role of communities and electoral representatives in let's say an example of rural Bihar or elsewhere in addressing and mitigating violence against women? And so over to you, Anamika.
Thank you. I think coming to the role of electoral representatives, what can they do? We have been working closely with electoral representatives in Bihar, and I think one of the most challenging aspects of addressing gender-based violence is its internalization as a socially accepted norm by both the survivor and the society. And I think here electoral representative can really play an important role in reinforcing it as a crime. And it will be much easier if they have, easy access to gender segregated data. And Women Development Corporation of Bihar has been releasing the Bihar Gender Report Card since 2018. And this report has been instrumental in underscoring the extent of gender-based violence in the state. And today I was looking at newspaper, and a lot of this report was widely referred by journalists and also by elected representatives in many cases. Then I think one important task is, promoting the help-seeking behavior among survivors, because there is guilt and stigma and insecurities associated with gender-based violence, which often prevent women from seeking help. And although there has been a surge in complaints received on helpline numbers during the lockdown, evidence from Bihar suggests that how a lot of reasons actually held women back from approaching the helpline for assistance. And the majority of women actually believe that the violence they had experienced is their fault, or it's nothing to talk about. It will tarnish family's honor, or it's women's lot. So, as I think I did not get a chance to share that in the initial days of lockdown, we were interacting with a lot of women organizations leaders to get a sense of what is happening at the ground. And our interaction indicate that women organizations who had been working on the issue, they had been talking about, there is need of training, there is dearth of staff, and there is lack of financial resources. And there are many other challenges that, helpline offices, and most of the times helpline offices were constrained with resources, and probably elected representatives could look into that. And so, although there is, one of the questions I was supposed to respond is that, yes, there is progressive system, but it has not been effective. So one of the reasons is that this progressive system is there, but at the same time, it's operating within a certain specific socio-cultural context, and these people who are kind of managing these systems are also representing Indian society. And so maybe in theory, we are a progressive system, but not necessarily we can be really progressive in our attitude towards women. So I think their elected representative could facilitate in ensuring, effective functioning of existing networks and institutions like, Mahila Thana or Helpline, and a lot of other institutions and networks are there. And all we need to do probably is to ensure that these institutions and networks are effectively functioning. Then this is again based on our interaction with local organization. It sounds weird, but it is true also to some extent that loss of livelihood has been an important reason behind rise in domestic violence. And many women organizations leaders suggested us that this is one of the most pressing concern. And one suggestion was that shelter homes could be, there is provision to provide skill training and also engage the residents of shelter homes in some income generation activities. So probably revival of shelter homes as a space where women could go without fear and also learn some skill to think about their future. Maybe someday when they come out of that shelter home, they could consider themselves economically independent. So I think these are some of the thoughts that I could, roughly arrange for on response to your question. What was the second question, Priya? I'm sorry, may I ask?
I just want to build on this. So it's interesting. What I think one of the issues is that what you were saying, that the norms are so pervasive, and the level of acceptance that this is a serious issue and needs to be addressed is very low. So even electoral representatives would hold those views. But does the state, or is there any relationship through policy of legal frameworks or policy frameworks that obliges electoral representatives to respond to this as a serious issue? And if you can talk about that, like, are there provisions, are there mechanisms, and they are not being implemented, or are there really no provisions? It's not even a policy priority.
I think there it is policy priority. Even at panchayat level, there should be a committee. Even there is one committee should be that is supposed to track the issues of trafficking at community level. But in most of the cases, we are just not aware about even existence of those communities. To begin with, most of the cases, committees are not formed, and even if the committees are formed, they are not effective. So, although yes, there are provision and there are institutions and policies and provisions and committees in place, but these are not effectively functioning to a great extent, I would say.
Yeah, and I think I also wanted to add from some of the research that I was doing on this prior to joining the foundation, is that, the cases, the way the remediation of violence happens for women at the level of the panchayat is very much suppresses avenues of empowerment. It's kind of reinforces that, you need to be within a protective framework, and the household is the most protective space for a woman. And that really links to the points that Girija started with, that if the home is not protective, neither is public space is protective. So women don't feel safe in any case, but there is an assumption that at least this is where safety is evoked. And I think, and therefore you should stay within the construct of the family. And this is coupled with the idea that, it's also on the chat, that women's low financial and economic inclusion and empowerment kind of reinforces this notion that women cannot be on their own outside of the family structure. So I don't know, is that a view that you feel is held commonly in the experience that you have working with electoral representatives?
I would say that okay. So one issue is that presence of women, be it in public space or in domestic space, and this year's NCRB report does indicate that more women are probably most unsafe at their home, because domestic violence comprises a significant proportion of crime against women. But at the same time, there is a clear-cut reluctance to presence of female body in public space is certainly not something that we are still comfortable with. And there is a long history. Feminist historians have discussed about it, that how at one level the Bhadralok movement was talking about progressive norms like prohibition of sati, or promoting widow remarriage or girls' education. But at the same time, home was established as the only safe space for women. And women coming out of home was certainly not considered, good women. So that notion is still there, I would say. And of course, there are a lot of policies and a lot of initiatives by the government which are kind of facilitating women's presence in the public space, and women's movement have played a very important role. So have a lot of elected women represent a lot of local organizations, but then it I think part of the problem is with the deepening of divide, it becomes very difficult to, female body has become a site of contestation, and violation of female body in public space has become a way to kind of demasculinize the other communities. And that is, I think, creating a lot of trouble, a lot of problem with the presence of women in public space. We recently completed a study on women's safety mobility in urban Bihar, and that is pretty much like what Girija had been talking about, how women feel while commuting in Delhi, and same cases in urban Bihar also. Most of the cases, women are not taking up the kind of courses they would like to take, or not taking up the kind of job they would like to take. So these challenges has always been there. And coming to women's organizations role, I think during the COVID crisis, a lot of women's organizations, I think they played a very important role during the COVID pandemic. Like some women's organizations were running helpline number, and they had some very interesting insights about what is happening at the ground.
Go to you, Girija, now. I think that, you've heard the discussion, and I don't know whether you wanted to kind of reflect on what others have said, especially post-COVID impact of on women's safety. But also, I thought if you can talk particularly about, how do all of these concerns about women's safety in public spaces really shape and they, or how do women internalize their own aspirations to be part of the economy? Like, how does it, I think you alluded to it in the beginning, so if you wanted to get a little bit deeper into that, it would be useful. So does evidence point to the fact that women's experience of public transport safety affect her personal goals related to education and work? So if you can kind of weave that together, it'll be useful.
So I think, in fact, that's when I said earlier that why is this so disturbing? I think this is one of the reasons it's so disturbing, because these are choices that are being made by the women or their families, sort of in response to these dangers that exist in the environment. So, they are curtailing themselves in a sense, which is both through aspirations or what they think they can do because of today they enter college. If they enter a good college, then tomorrow they'll have to work, but we cannot work because we cannot travel to work. So sort of, yes, it's like a vicious cycle that women are stuck in. So I think that has a key role to play. There is not that much evidence right now on aspirations. I'm actually in the process of working on this based on data from Delhi with women who are in vocational training institutions, and we find that their aspirations are a lot lower than comparable men in terms of how much they think they will work, where they will work, and what they will earn. But we are in the process of linking it to their perceptions of safety. So I will have more evidence on this soon. There was also another point that I wanted to make on sort of, if we think about it, that one is the aspirations of women for themselves, the other is the aspirations of parents for their children. And we are seeing that, the education gap between men and women is shrinking at an early age. We see higher rates of enrollment across the board. We are seeing increased outcomes. We see that girls actually end up doing better than boys in schools across grades. So this is, I just want to say that, this is a constraint which has the possibility of removing all of that if we do not sort of address it at an early stage. One thing which was mentioned in the chat, a question which has come up, which I think is very important to the labor force discussion, which I heard earlier, is greater control over resources. So this is just something that I've been interested in. So I just want to speak to it, even though I don't have work on this. But there was recent, very interesting work in Madhya Pradesh, which looked at women and men employed in the National Rural Employment Guarantee Scheme. And they see that if women were provided with an account, they were just asked to set up a personal banking account in which they could deposit their money. We see that there is an increase in employment in the National Rural Employment Guarantee Scheme. So women, if they know that they will be able to control the resources that they have, actually increase their labor force participation. So I just wanted to speak to that there is work, and that's actually a very important point.
What might be, I mean, do you have any thoughts about, sectoral interventions, like let's say the transport sector or within the economy or industry? What might be interventions that actually give the signal at the point of entry or source where women are making decisions, or even prior to that, like in schools, when women are making decisions as to where they should, what stream of education, how much they should educate themselves, and what might be likely opportunities. So if you can just speak to that, because I think the signals are all mixed up, and they don't really match to the, obviously they don't match to the reality as well. So if you can just speak to a little bit to that, like what might be some strategies.
Absolutely. So I think if there are two ways of thinking about this. One is we can think of it sectorally. The other is if we just think of, what can be done immediately and in the medium term and in the long term. So I think in the short term, we can think of information campaigns, raising awareness of the access to opportunities, and how important it is for women to be in the public space. I'm thinking of initiatives like the Blank Noise initiative, where women are asked to reclaim the streets. This is public space for all, and sort of increase, why loiter, sort of just reclaiming the public spaces. In the medium term, I think, is the kind of interventions that have been implemented in public transport right now, which is segregation. So, give women a separate women-only car in the metro, or, create women-only buses, and then have men travel separately. So there is work on this. There's work in Mexico and Brazil, which actually shows that women-only cars do work, in which that women feel a lot safer. It reduces the amount of harassment faced. But something which is not taken into account, first of all, is that this is not sustainable. You can't have 1 out of 8 or 1 out of 10 cars for approximately 50% of the travelers in the metro, and you expect all women to travel by that. It's just not going to work in the long term. The other is that the same studies found that there were unintended consequences of putting women in segregated cars. In Mexico, they found that there was an overall increase in the physical violence, men on men, from having these segregated cars, because it increased congestion. And in Brazil, they actually found that women who were then traveling in the in the general cars, where both men and women were allowed, they were perceived as being, they were perceived as asking for it. That if you're not traveling the women only cars, then you're asking for abuse. So it increased the stigma from traveling in the general cars, which, just to reiterate, they have to, because there's not enough space for them to travel in the women only cars. So these are the kind of things that are being done in public transport in the medium term. But in the long term, it comes down to the design of infrastructure for public transport. Currently, the design of infrastructure is not even gender aware, leave alone sort of, gender transformative, transforming the constraints that women face. So, for example, if you look at the connectivity, so last mile connectivity affects all vulnerable groups, but also women. So I was thinking of, you asked me earlier, Priya, like what causes street harassment, and I sort of went to the norms, but it's also what have we been doing to reduce it? Not much, right? So as we can see from safety pin data, that there are dark spots around the city, which then make women feel less safe. And that is where, they choose not to go. And that might be in the vicinity of a great college, or it might be in the vicinity of some high paying jobs. So designing infrastructure to address constraints that women face would probably, be a powerful tool for public policy.
What you are implying is that it's not just a question of investing more resources, it's also about intuiting on better designs. So it's a combination of that. Because often again, the
Absolutely.
argument is we don't have enough resources for X, and how do we prioritize these issues? But what you are saying, and I think what Padma also said, that these issues are integral, and you can use similar resources but design things differently to get more
And
efficient.
also just
Yeah. No, please.
absolutely agree. And just one thing to say that on that, that infrastructure has long-term effects. So what we design today will stay around for many, many years, a decade at least. So that is why it's very important to incorporate, the constraints that women face at an early stage, at the design stage. And then that will affect, we should not be thinking of, it'll help our girls traveling today, but it's going to help girls travel for a decade. You
Absolutely.
can't.
And there's somebody, Devki from the chat is telling us that in Bihar, women have been, in terms of solutioning, women have expressed a greater demand for improving walk paths, lighting, since most of their work is by walking. And so improving last mile connectivity, which is a point you said. And I think it is an issue of recognizing that women's work is worth their participation in the economy, and therefore we need to make it happen. And I think that's really
Yes,
important,
exactly.
because we can't, I think, as long as we are underselling that contribution of women's work to the economy, we may not be able to prioritize it the way it needs to be. So, absolutely. So, Padma, I mean, there are questions that I think you can answer, and which was really going to be my question to you, which was much broader. So, there are examples of one stop crisis centers integrating a response within the district hospital, like you're doing with Dr. Gundappa. But the point is, and Bihar, right? The Saja intervention. But the point is, what is the quality of these services? And what is the actual experience of bringing the standards at the level that they need to be as per the WHO guidelines, for example, or even halfway there? So what are the struggles, what are the challenges, and can you comment on some of these, the quality concerns?
Yeah. Thank you, Priya. Before I answer your question, I just want to, connect to what Girija said, and you
That'll be
asked
nice.
about the infrastructure. Just want to, bring to the audience that in Mumbai, the development plan has actually integrated a gender perspective into it. Like what you said, Priya, about creating infrastructure. So at the level of planning of the city itself, and it's largely led by Akshara in Mumbai. So some of you in the audience and the panelists may want to kind of look at that, and those are very good. And we are hoping that all of those will be implemented. Coming to your question, Priya, I'll look at it in two ways. So, all these health systems responses have been kind of actively led through training and through adherence of certain standards of care and monitoring and other things. So a lot of them, if you actually go to see, they are providing women-centered care. So whether you look at it in the Sajha work, or the medical colleges, or all the other crisis intervention departments in all these district hospitals in NHM. I think the larger issue, which I think you raised in an earlier, point about what's happening at the village level, and I think that's happening largely as far as the quality of care for domestic violence is concerned in our country, is this whole preoccupation with settlements. And whether it's one-stop centers, it is helplines, it is a lot of other state-run agencies, the entire focus is on signing bonds on samjhauta. And if you, and this is, I want to kind of speak a little on it, because I carried out the one-stop center rapid assessment 2 years back. And some of you may know that Shireen Jijaboy actually conducted a survey of of a large number of women who had accessed helplines in Bihar. And her paper has been published in EPW based on that. So we do have some evidence. And what it shows is that the focus is on joint meetings, on reconciliation. And I think, this whole thing about telling women to go back because that's the best place for you, and just adjust. And I think those, and some of those issues which we often don't, talk about, and those need to change as far as service providers are concerned. Because if women are coming for support and they are being told to go back and just accept what is happening, adjust to what is happening, that's a matter of concern. And Shireen's study actually shows that to some extent, some of these women reported reduction in physical violence, but there was no reduction in emotional violence. In fact, in a large number of cases, there was increase in violence. So obviously, these settlements and reconciliations and bonds are not working. And there needs to be a more stronger women-centered approach, which takes a very clear position that violence will not be tolerated. So I'll just kind of, the audience maybe, I just pulled out some perceptions of these service providers when I interviewed them. And what I found was that there was very little clarity around domestic violence, marital conflict, quarrels within marriage. So all of it is conflated. There was a whole perception amongst service providers, and I'm talking about counselors and psychologists, about false cases in domestic violence. So notions such as if a woman refuses to go for a joint meeting, so she says, no, mujhe sirf complain karna hai, or I don't want my husband to be called or my natal family to be called, they perceive it as jhoot bol rahi hai. Or if she, her body language, so she's not so basically, if you're experiencing domestic violence, then there is a certain kind of notion about how you should present to these counseling centers, because you want the marriage to be preserved. Frankly, most women want the home to be, the marriage to be preserved, but the violence to stop. And I think there's that distinction is not made in these by the service providers. Also notions such as parents beat up their your parents were beating you up when you were in your home, so why are you making a complaint if your husband, or so there's a whole larger uh, sanction to violence in our society. So we can't deal with domestic violence and even violence against women in public spaces without recognizing that in our larger society there is violence which is condoned. So violence against marginalized groups, against certain minorities, is something which is condoned. So I just wanted to kind of highlight those, and therefore a lot more needs to be done in terms of really squarely putting zero tolerance to domestic violence at the core of these services. There's some evidence from a study that was done in antenatal care in 2 hospitals in Mumbai, where they found that just providing empowerment, counseling to women coming to ANC and who have disclosed domestic violence, it has actually helped in reduction of violence and in improved well-being and health outcomes. So I think those are the kinds of things that we need to really discuss when we are talking about responses, the quality of responses.
Padma, very quickly before I go back to Anamika, just one is that there aren't resources, but then the person just wrote that there are resources like the Nirbhaya Fund, which is largely underutilized. And so, can you talk about how do you unlock resources for these interventions?
Absolutely.
Do
Thank you for that question.
Yeah.
So, so the Nirbhaya Fund is a huge fund. As you all know, it's underutilized. Under this scheme, one of the flagship programs is the one-stop centers. There are 660 or more one-stop centers that have been set up using the Nirbhaya Fund. More than 50% of them are located in hospitals. And you will be surprised to know that they are located in hospitals, but they have nothing to do with the hospital. So it really functions as a separate building within the hospital campus with absolutely no sectoral collaboration with the hospitals. So women coming to the hospitals may not, in my rapid assessment, I found that 5 of the OSCs that were based in hospitals had not received a single referral from the hospital. Okay, so that's the lack of coordination. And I think, that level of coordination, because you have a whole infrastructure, 660 one-stop centers with designated staff, with shelter facilities, with lawyers, connections to program, protection officers, a police facilitator, and a doctor on call. All of that infrastructure state has put in place. But unfortunately, that was not even available during lockdown.
Sorry, one thing that I do want you to quickly talk about is that, like, we critiqued the typical response, let's say, of remediation and ghar wapas chale jao in a, let's say, in a rural setting. Maybe obviously it happens everywhere. In the optimal design in the hospital, what is the way that providers are trained to respond around this? So the question that I want to ask you is, your intervention is based on certain constructs of kind of helping people, even providers, really think through from a gender perspective.
Absolutely.
So could you just quickly talk to that, and
Yeah,
then
sure.
we'll move to Anamika? Okay.
Sure. So, as you may all know, that the clinical guidelines of 2013 actually provide a clear guidance on the clinical response by providers. So, and they have an acronym which is called LIVES. So, the whole idea is to train providers to listen to women, inquire about what is happening in their lives, inquire about the current episode and the past episode of violence, validate. And I think validation is easier said than done. And therefore, the training of providers really is critical, because validating somebody means that you are reaching out and telling her that what's happening to her is not right. And so validate and inquire about safety. So if she's is she safe? If not, what can she do? Whom can she call upon? What are the various numbers that she can call? Is there a place she can go to? Who are the people? All of this becomes important actually, because when a doctor is doing all of this, or a health provider, somewhere the survivor is getting a message that what is happening to her life, in her life, is wrong. She's not to blame for it, and she can reach out and seek support. And lives, the S of lives is really to enhance support services. And I think that's where the whole challenge, even that we see in Bihar, and even in the medical colleges in Aurangabad, that where you're linking up to existing services which may not be of good quality. And that's where then the role of the health sector becomes extremely challenging, because you are identifying women, you are able to provide basic immediate psychological support, but when she needs other specialized services, those may or may not be available. Or then you need somebody at the hospital to ensure a women-centered response, say from the police, the shelter, or the women's helpline. Those are the challenges.
Okay, great. Thanks, Padma. So, Anamik, talk about the role of community post COVID. Like, how has that changed in terms of responding to violence against women? You can talk about what about men? Like, men are weak, men are emotionally vulnerable. We're not talking to men. And also, what is the role of kind of really bringing in that perspective if the violence is largely perpetrated by men? So, I don't know if you feel comfortable talking to that. Otherwise, we'll put that in the closing remarks. But you can weave it in, because many of the electoral representatives are actually men and can talk to other men in the community.
Right.
So, over to you.
Thank you, Priya. I'll just first, this was very interesting discussion, especially when we were talking about Padma and Girija both were talking about how women's economic participation is deeply affecting their space in the society. And there are research, even back in 90s, we had research that indicate that how women's recognition of women's economic contribution is deeply connected to their health and survival. And if we look at the Gender Global Gap report, we can see that in terms of health and survival, we are doing horribly, bad. And part of the problem is probably because we are not able to recognize women's contribution to the economy and the society. And because her contribution is not recognized, her existence is also not that significant for the society. Coming to the first question, I will say yes, I agree. Part of the yes, it is Madhuri's question. Yeah, there is poverty and loss of livelihood and alcohol are often referred as triggers of behind violence against women, but we don't hit our boss or senior member in family. We hit women because we understand that this is somebody who can be subjected to violence, and there is nothing wrong in it because there is acceptance to it. Coming to one question which is already mentioned about the shelter home, and also about what you raised, Priya, that what could be the role of men in sensitizing and preparing them for, counter this kind of violence. I think most important thing is to recognize women as fellow human being, and we have not been able to establish that, unfortunately. And as we know that people in police and elected representative, everybody is working, but at the same time, they also represent the society. And I would just like to share one example, which is coming from one of the experience of my organization C3, but at the same time also, we realized during the COVID crisis that community level collectives are playing a very important role. They are very effective in addressing domestic violence or issues pertaining to community level tension. And these collectives could be comprising of panchayat member or self-help group member or frontline workers, and of course, grassroots level organizations. And I think the greatest strength of these collectives is that they are embedded within the community and they're able to reach out to the survivor whenever they need, and they're also able to maybe they're better positioned to track the incidences of domestic violence and or incidences of gender-based violence, and they can also provide support and relief to women. So their role becomes very important. C3 had one initiative called Do Kadam Barabari Ki Or, which was evaluated by Shirin and Santha. And that initiative does indicate, I mean, because in this initiative, we try to engage local leaders, especially men, and try to capacitate them or sensitize them to bridge the gender gap at local level. And evidence from that initiative suggests that frontline workers and these local community level initiatives or collectives could play a very important role in addressing gender-based violence. I think in Patna, which was one of the intervention districts, initiatives were taken to orient and engage local elected leaders and like members of Gram Panchayat and Gram Kachehri. And the idea was to, sensitize them about gender norms and try to, persuade them to change unacceptable gender norms, especially gender-based violence, domestic violence, and also to work for preventing gender violence. And Shirin's and Sandhya's evaluation report indicate that most of almost all Panchayati Raj institution members who were associated with intervention, they disapproved domestic violence or gender-based violence as acceptable norm. And actually, they insisted over reducing alcohol use in their village. So that was, I think, a very important and effective initiative. In fact, they also worked for promoting violence-free marital relations in the village. They would go and follow up. Those follow-ups and those constant and regular interaction are very important. And I think it's very important to capacitate those initiatives because that can be sustainable, that can be regular, this could be a space where people could go or people could rely and seek help in times of crisis. So there is one question, and I think that's related to what you also raised, Priya, about shelter home and how we are sensitizing.
Yeah, if you can speak to that, and then we'll do a rapid round after that. Yeah.
Okay. So I think there is a need to work towards integrating gender sensitization program in school curricula, and C3 has been working with Bihar government, and it's facilitating a program which is basically a life skill development program for adolescents, and gender sensitization is an important part of this program. And I think elected representatives could facilitate in initiating and promoting such programs because it is important to work for ensuring that children of different genders, they are growing in two different worlds, probably almost alien to each other. And we have been witnessing brutal cases of violence against women or even rape in which convicts or accused boys, young boys, maybe under 18 boys. While these cases does indicate that there is a violent aggression towards women, it also reinforces that women are not being considered as fellow human. And that is something which is a very basic thing, but it needs to be kind of reinforced and reinstated time and again. And I think gender-based segregation, often allows boys and girls do not allow boys and girls to know each other. And in most of the cases that entitle men as the privileged gender, which actually, so women are not even considered as being, but rather as a thing. And I would say that, local leaders or elected representatives or community leaders or even government could possibly work with the community and educationalists to kind of check those processes that instigate, this transition of boys becoming, growing as potential rapists. That is something that we need to really think about and start at a very early stage.
questions are actually about
Yeah.
bringing large gender transformations and attitudes. And I think my response, not as a panelist but as a moderator, is that there's no singular intervention, right? It is the collection and the aggregation of many interventions which are all going and signaling in the same direction. They're not contradicting each other, because on one hand you have interventions that are creating safe spaces, they are provisioning cycles for girls, they are creating employment opportunities, and there are all these yojnas. On the other hand, you have this public discourse on love jihad and something else. So there are all these confusing messages in society that's not helping the agenda for bringing about attitudinal transformation. So I think the message has to be pretty uniform, whether it's designing an intervention or a public interest campaign or a law. And right now we are not at the point where these messages are uniform, and that really does confuse people. It definitely will confuse young people, young boys. And the other thing is, where are the positive role models for young boys and girls? So if the role models are those who are perpetrators or victims of violence, then it just kind of becomes a self-reinforcing prophecy. So it is a deep change that we are really talking about. In that, I mean, given that as like a large frame, Girija, the question to you was, to all of you, was going to be, tell me one complementary intervention to something that you feel very strongly about. Let's say for you it's women in public spaces. What is a complementary intervention to that which is essential in the short and medium run in order for the shifts that you envision to happen? There is a question to you which says, should we prioritize addressing women in public spaces versus intimate personal violence? So you can kind of weave this into both, and just very quick responses, not a lengthy one. Yeah.
So just there were also two other questions about rural-urban divide and
Go ahead, answer that,
street.
so you can just
So
take
so
that on.
so yeah. So the evidence is that street harassment affects women across wealth levels, age. Usually, women have their first encounter of sexual harassment in public spaces between 14 to 21. So younger women are more vulnerable in that sense. Both rural and urban areas have their own issues, but this sort of safety in while traveling, commuting has been found to be relevant. We know from Bihar where cycling to school scheme worked really well, and one of the reasons that was alluded to as part of that was girls felt safer on the bicycle as opposed to walking, and that had a major effect. So just to say that this is present everywhere, and this is a big problem which is holding women back. In sort of weighing domestic violence and street harassment, this is really hard. One is very little understood actually, and the costs associated with that are so deeply entrenched. Domestic violence is one of the hardest issues, biggest public health problems. So I really cannot speak to which one is harder. I personally, and based on the evidence that exists, domestic violence is violence that women face with the perpetrator who they are living with at home. I mean, it's I we just cannot compare these, but that is a huge problem. So in terms of what would be policy interventions in the short medium term, I think designing public transport needs to happen in a gender aware way from now. The design has to change. This can be last mile connectivity. It can be simple designs of the buses where, the way you hold is not designed for women. The doors are narrow. You have to brush against people to enter. So simple design changes that need to take place, which, yes, have huge cost implications because this is literally physical infrastructure which needs to be changed, but it needs to happen. Other change which needs to take place, and we have evidence, is sort of targeting gender attitudes at an early age in school. And we've seen that light touch interventions of in Haryana, there's evidence that 45 minutes speaking to boys and girls has been found to change their attitudes towards girls and violence against women, both sort of girls in strangers, the women who did not know, and also at home. So that's where I'd stop. That all, changing infrastructure is something that needs to start today, which will have long-term impacts, and gender attitudes at a very early age in school through light touch would be my interventions of choice.
Okay, Girija, before you leave, there's a question that uh, to everybody, what is the link between violence against women and poverty? Do you want to take a second on that?
I mean,
Or
so
would you rather Padma do it? It's
just very
complete.
quickly,
Yeah,
if we know that women are choosing to not enter the labor force, and that leads to reduced economic resources, then we are sort of putting them in this vicious cycle which perpetuates poverty. There's one thing which is poverty in terms of monetary resources. The other is also time poverty. Women have to spend so much time in deciding how to travel, where to travel, that we are just perpetuating also their time poverty, which then also feeds into overall poverty.
right.
And
So
Padma
yeah,
should.
yeah, that's really useful. And
Yeah.
so if you just want to like close with just the role of complementary interventions in the short and medium term, so that one doesn't get overwhelmed that this can't be done, but there are things that you have to do to really be transformative. Yeah.
Thank you, Priya. And I'm sure, Kumar is sharing the link. I would request everyone to see it. Had we been able to show the film, that may have been a better way than hearing me talk about it. But I'll try and be as short and crisp. I think we all agree that multiple level of interventions are required. So even at the prevention level, gender transformative, working with men, all of that is absolutely essential. I'd like to also draw the attention of the audience to the fact that the NFHS latest round actually reports a drop in women accessing any kind of support service. And the drop is of 10 points. So from 24% women who reported domestic violence and having accessed any support services, it's come down to 14%. And I think there's something that we need to dwell on about it, because it shows that there is a culture of silence, and women are not able to come out and receive services. So as along with working towards prevention of violence, I think we need to really foreground our good quality support services, so that women are able to come forward and stop violence that is being meted out to them. Both the medical colleges in Maharashtra and the Bihar experience actually show that through this whole work of training providers, what's happening is that a large number of survivors of domestic violence are being identified at the facility and being provided services. So if you look at medical colleges, and you would have heard doctors actually talking about it, about not so going from very obvious cases of assaults and rape to actually identifying other signs and symptoms as part of clinical inquiry, to things like late antenatal registration, or a neglect of health, not coming back for follow up for in the medicine OPD. So somebody who's identified with fever or TB, she's not coming back. So that's the point at which they are asking about abuse, to unwanted pregnancy. So there's a whole range of signs and symptoms that are getting picked up. And in Bihar, I just want to kind of place before you, it's a pilot and it's still underway. It's supported by Gates Foundation. Within 3 months of this rollout of the program and training of providers, what we found was that across 5 facilities, we have 100 women who were recognized as survivors of violence by providers within 3 months. And this is a situation where this is a scenario. Please bear with me that it's a district hospital, sub district and PHCs where violence was, even when we asked them about violence against women, they only knew about the women brought by the police for rape examination. There was no other recognition of violence. From that to having 100 women actually being asked, identified, and provided services at the facility, and being connected to the other relevant services, I think that's an important intervention, I feel, because it's one is prevention, but actually women who are actually suffering also require support. And to this, I would like to also raise the point about COVID-19 and what it has done. We all know that the structural violence that the pandemic has unleashed is absolutely unprecedented. As we see in the loss of employment, insecurity, the discrimination and hate against minorities, increased domestic work for girls and women, and the fact that services are difficult to access because of the nature of the pandemic. These are not being tailored to the situations of, if women are not able to access, then can a protection officer actually file a online complaint? These are the kinds of things that we really need to ask from the state agency. A lot of this work has been done and led by civil society organizations. Aman Network, which is a network of CSOs, more than 150 in India. They've been actively working. They've compiled the data of what the civil society organizations actually did during the lockdown between March to mid-June. And most of the organizations actually re-strategized their whole way in which they were providing services. And I think, as Anamika said, a lot of their experiences allude to how reaching out to, the mukhias and the panchayat members became the only way to kind of ensure that the woman is not thrown out, or there is some kind of vigilance over what's happening in her household. So those are some of the things that we really need to keep in mind, and COVID is going to continue, and the need for rebuilding the entire public health infrastructure has come up very sharply in the pandemic. The unregulated private health sector continued to indulge in overcharging, and has kind of just not been accessible for most of the population, and not even for non-COVID care. So, that's the state of the unregulated, commercialized private sector. So we have to rebuild the public health infrastructure. And I think that's the opportunity for us to also integrate a response to violence against women within the public health system, so that we can actually reach out to larger number of women at an early stage of violence.
Great. Thank you. Thank you, Padma. I'd like to just end with, for me, why this panel, of course, is important. These are issues close to heart, but they brought different dimensions of violence against women, and how this is a large, big societal response is in order. This isn't just, can we have a magic bullet, or can we do this intervention? If there are design issues, there are rethinking issues, there are huge attitudinal change that are required. There is evoking systems and fortifying and strengthening systems. So this is a long agenda, but I think that doesn't mean we find this so overwhelming that we don't take this on, because this affects a large proportion of the population that gets very seriously disadvantaged, not just because of the experience of violence, but all the other opportunities that get denied to them because of that. And we are talking about women. We haven't even begun to talk about women with disabilities, trans people. I mean, once you begin intersectionality, low caste women, it just goes on and on. The disadvantages multiply and get more and more aggravated. So I think that, to me, is a really important issue. And the second thing that Padma said is, let's take this as an opportunity. What COVID is going to do is that it's taught us that we are all talking about resilience now. I don't think this was so much a part of our vocabulary earlier, but now post COVID, we're talking about resilience in a big way, and we recognize that there people have embedded in them strength and solidarity, and that people can rise to the occasion. I think what we really need to do is use this, the ideas of resilience, even in our work around gender transformation. So we're not only talking about gender transformative societies, but we're talking about gender resilient societies, societies that can weather the kind of shock that we are seeing every day on gender issues and rise above them and kind of be more and I my hope is that it's the next generation of young people. This is where I see a lot of the energy coming, where people are saying we're not willing to take these inequities. They don't work. These kind of disadvantages and inequities don't work for a society we want to live in. And I feel like that to me is very, very important narrative. The more we say it, the more we internalize it in our work, and kind of not take this as an overwhelming challenge but really as a huge opportunity, the more we'll be taking the steps towards transformation. So with that, I'd like to just hand it over back to IGC to conclude, and thank you everybody.
And now I will request Prabhat Ghosh, Director Adri, to give the vote of thanks.
Thank you very much, Kumar. I think job has already been done by Priya, so I have got to repeat what you're going to say. First, I should thank Priya for steering the whole discussion. Very informative trajectory. We covered nearly all the aspects of the problem, and in doing so, you also did not lose sight of the specific dimensions of each problem. That's the one. I'm also thankful to Anamika, Girija, and Padma for sharing their wide experience in this field. Not that I am not concerned about women issues. I am an economist. I do think about it, especially from the point of view of labor participation and and the kind of economic role they play, which is not recognized in the economic framework. That's one of the worst things that can happen to a person. But I feel that all the discussion that we had during the last 1.5 hours, would have been more useful if each observation by all the experts were supplemented by what he called hard facts. Okay. As far as I know, NFHS is the only source from which you get data on women's economic activities and is reproduction related activities and the violence related happenings, all this in a comprehensive manner. It's useful. I have seen many studies using those data, but I presume that IGC should take note of that specific service, household service, where these issues of economic deprivation, social deprivation, sexual harassment, and other kinds of things are done in a specific small service where more details can be taken care of. Just the way we do a survey on agriculture, we do a survey on employment, or we had a survey on reproductive activities, We should do more surveys which are entirely on women. Their social, their economic, and their other biological or other aspect they do. It will be much, much rewarding to collect some data and then substantiate the points that the experts will make. For example, I tell you, when you talk of employment, as Girija was saying, we are able to give solid data to supplement the point that we are making. But in case of women's deprivation, such data is relatively unavailable. I think IGC could play an important role to fill up that information gap and make our discussions more, data related, data based, and things like that. With these observations, I thank you all again, and I hope we'll meet sometime again to carry forward this discussion. Thank you very much.